Respira duro así con la boca abierta.
Primary care for all is more than a health insurance card.
Muy bien. No mueve. No mueve.
It really means somebody who knows you, who cares about you, and with whom you can partner to establish your goals.
Can you take a big, big breath for me?
The vision, the dream would be a person, regardless of their circumstance in life, can find and have a team, a person, a coordinated group of people who are really focused on their needs.
Primary health care for all is something we all have to pursue. That should be the holy grail of healthcare delivery in this country.
We absolutely need to make sure that there's primary care for all, and that means providing financing to renovate, to build new sites, to expand, ensuring that there is primary care available in every community.
All those things that the team is talking about is documented in here. And that's
A
one of
care
the reasons,
coordination,
obviously,
the people who are really able to reach up to the patients and teaching them, educating them how to live the healthiest lives. All those things have become a part of the primary care of the present day.
There's a lot of talk these days about patient-centered medical homes, but community health centers, federally qualified health centers, and Health and Hospitals Corporation have always been thinking about community-oriented primary care. It's so great to see you.
Great to see you.
What a great
So glad you're here.
Very exciting.
We're doing what's called an integrated model where we have medical providers working alongside of behavioral health providers. We also have staff members whom we call behavioral health integration specialists.
The definition of primary care is a little bit more fluid than it used to be, maybe a little bit more team-based than it used to be.
Habla boca. Very good.
We here at Open Door are a high-touch organization, and we feel very strongly that that relationship is at the foundation of not only a healthy patient relationship, but it's actually at the foundation of a thriving community.
We know that patient-centered medical care can't happen without thinking about the broader community. It's not just a question of a physician and a patient in a room together for 15 minutes and that's all you get. It's really thinking about the whole person, and that person in the context of the community in which they live.
So take a big breath for me.
This is a fundamental change. It basically tells you, look, your care does not stop when you leave my office or my clinic. It continues into your community, into your homes, into your day-to-day activities. We are excited just stepping out of this medical silo and getting into the social economic conditions. And PCDC has been a leader in advocating for that.
Elevated blood pressure turns red.
PCDC is an expert in primary care, and they have wonderful consulting services that support health centers in delivering the most efficient, impactful care to a community.
There is such a great focus right now on primary care, sort of broadly defined, that it's a tremendous opportunity for PCDC to work with different components of the delivery system, the healthcare system, the wellness system, and for PCDC to play an even more important role than they have in the past.
We want to make sure that our advocacy work is still as strong as it can be. A place where we can bring together the organizations, the providers, the consumers, the healthcare insurers to advance the voice of primary care.
I had the great privilege to participate in a panel recently that considered how we might expand spending in the primary care sector.
It's a resource-constrained system right now. People are trying to figure out how to move available dollars around within the system, and that's always painful.
This is the referral to Dr.
We have a system which is skewed in favor of specialty care. That is where the 95% of money is spent, but 51% of our interactions are in primary care. So the underfunding of primary care need to change.
If only 5% of the $3 trillion that we spend in this country every year is spent on primary care is pretty much stuck. I believe what Dr. Raju has talked about changing the paradigm from providing sick care to providing well care. The same thing happens at Open Door. The same thing happens for Healthfirst. And if we are out there by ourselves, we know that we won't be successful. Our goal is to catalyze the transformation of primary care so that every person, every community is able to be as healthy as they can be.